All right, so today we're just going to be testing. My name's Gianni, I'm your student physical therapist today. So what we're going to be testing here is just seeing how kind of some of the vertebrae in your spine are moving. So particularly in this cervical, kind of by your skull area. And we're going to do a couple special tests to kind of figure out if there's any type of nerve root involvement or you get any numbness or tingling down your arm, okay? So the first, what we're gonna do is we're doing a posterior to anterior glide. So what we're gonna be doing here is I'm gonna find the spinous process, and then what I'm gonna do is take just a little slack here. So what I'm gonna be doing here is I'm just gonna kind of pushing down and assessing how well your joint moves. So we're assessing joint mobility of the vertebrae here in the cervical. So I'm just gonna get a little slack here, and then I'm just gonna test for that mobility. So I'm gonna see if you can get some full range of motion first. So a little bit slack, spinous process just outside of it, and then we're just going straight down. Good. Okay, I would say that's normal joint mobility. So what I do for a 1 is I'd be right here and just nice and easy. For a 2, a little bit bigger of a motion. Three, pretty deep. And then 4, I'd be at the very bottom, just there. Good, relax, okay. Good, that feel okay?
Uh-huh.
All right, we'll move on to the next test. Okay, for this next test, we're just gonna be testing, so we tested how your cervical vertebrae are moving forward and backward. Now we're gonna test side to side. So what I'm gonna do is I'm gonna do some side glides. So the pillars here, I have my fingers in this area here. And what I'm gonna be doing is I can go to each segment. So with each one of my fingertips, I can just kind of move down. But what I'm gonna be doing is just assessing her motion on a unilateral side. So I'll be going to her left. So here, I'm just going here. I'm kind of getting that scoop in motion towards me. And go down, down. And I would do this for both sides, but for this one, I did it just on the one side. Okay, so the next test is going to be a cervical distraction. So what this is going to be doing is just, if there's some pain from the compression of the spine, this should be a relief of pain. So what we're going to do in here is if we had some neck pain in here, doing this procedure would kind of relieve you for a second, so it would feel relief of pain because your spine is kind of compressing on each other, okay? So I'm going to be around the articular pillars here, and then I'll just go up to the base of the skull, and then what I'm going to be doing is I have my arms extended, nice and straight here, and then what I'm going to be doing is taking the tension out, and then I'm just leaning back, Relax. Feel okay there? Mm-hmm. Okay, like I said, that would be for any relief of pain. So next test we're gonna do is upper limb tension test on the median nerve. So I'm gonna have you scoop down just a little bit. So this is, so we'd start with the unaffected side. So for this one, let's say the left was affected, so we're starting with the right. So what I'm gonna be doing here is I'm just gonna be testing if you have any symptoms that reproduce from when I put your arm in this position, okay? So any of that numbness or tingling or something you feel, you just let me know, okay? All right, so first I'm gonna start off by depressing the shoulder here. I'm gonna put her arm in abduction and external rotation, and then my knee's gonna support at the arm here, and then what I'm gonna be doing is extension of the fingers and wrist, and then from here what I'm doing is I'm just extending the elbow out. So she's letting me know if she feels symptoms, anything there. Good. So if that doesn't work, then what we can have her do is her head's faced in neutral right now, so I'd have her turn her head away from her arm. Turn her head away from her arm that she's doing right now, and then seeing if that reproduces the symptoms. Anything there?
Nope.
Okay, so then sometimes that can reproduce the symptoms as well. And like I said, we would do that bilaterally, so we would hopefully see those reproduced symptoms on the left side since the right was normal. So then the last test we're going to do is a Sperling's test. So that's testing for if we have any upper nerve root, any nerve root involvement here. So I'm going to have you sit right here. And then it could either be that or the joints, they're inflamed, causing some of that pain localized as well. So what I'm going to be doing here is I'm just going to kind of be pressing down on your head a little bit. You just keep it nice and straight for this one, and then there's another one where your head's at a different angle, but you just let me know if you feel any pain, either any part of the spine here or anything going down either side of the arm.
Okay.
And then, so for the first one, I'm going to be here, and then we're just pushing straight down. Anything there?
No.
Nothing. So if she didn't have anything there, what we could do to localize it maybe a little bit more is if it was on the right side, then I'd have her go into an extension here and then side bend to that side, because now it's really compressing those vertebrae there. So that would hopefully reproduce the symptom. And then same thing, pushing straight down. Good. And then, like I said, if there was any localized pain in that area of the vertebrae, or it would go numbness or tingling down the arm into the fingertips, that would indicate nerve root involvement. So, awesome. Thank you very much.
Thank you.